All right, guys, thank you. So we've talked a lot about balance and preparing more from a physical, whether it's doing the exercises or the spinning babies model or Body Ready Pro. And now we have Taylor Musgrove who's going to talk to us about her own experience with hypnobirthing and the work she does through providing hypnobirthing instruction classes. And so we're going to kind of think about that mind approach because we know that body goes through a lot physically during labor and throughout the whole pregnancy. And, we focus, those, so there's two different areas that we can focus on. One is like physically, is she ready? And does she have the tools mentally to, to be calm, to understand what's going to be happening to our body? And so hypnobirth is, a way that we can help moms kind of look at that mind body approach together. So are you on, Taylor? I think Tavangi's going to get your slides up. I think I saw
Yes,
you.
I,
Okay,
I am
great.
here.
Well, we're excited to have you here and we'll get your slides going. And everybody, this is Taylor Musgrove.
Hello, and thank you so much for that, Dawn. I'm happy to be here um, and share this space with you all. I think, the birthing world is about to take a huge shift, and, you know, a lot of that's due to the Arkansas PQC bringing all of us together. And there's such an overlap with all of these educators. I've recently spoken with some hypnobirthing educators who are Body Ready Pro certified, and spinning babies practitioners are always mentioning, other certifications. So this is one that goes well with anyone interested in maternal health, even, yoga instructors, hypnotherapists, pelvic floor therapists, nurses. A lot of doulas tack this certification on to, just better serve on the front end, preparing their patients mentally. So that's really the scope of my certification. Is I really help empower and engage with mothers and couples, just getting them to, their birthing space, and doulas and nurses and all the other professionals take over after that. So I'm happy to share with you guys. Okay, you can go to the next slide, sorry. The learning objectives today. So I hope that you learn the definition of hypnobirthing and that you're able to explain the benefits and techniques of hypnobirthing, as well as you will experience some self-hypnosis, and you'll be provided some insight into simple steps that you can use to empower and alleviate fear. Next slide, please. So here's the hypnobirthing philosophy. Hypnobirthing is a childbirth education method that focuses on using self-hypnosis, relaxation, and breathing techniques to help women achieve a calm and natural birth experience. Another way to simply put it is by harnessing the power of the mind-body connection. Hypnobirthing aims to minimize pain and intervention, making the birthing process more comfortable and empowering for mothers. So a little bit about what led me to hypnobirthing. I actually had like a very debilitating fear of everything medical all the way through my college years, and I would go get simple, vaccinations just required for school and pass out. I would go get my finger pricked and pass out. So I had this vasovagal reflex going on in every type of medical environment. And so when I met my husband and we decided to have a baby, I was really spooked. And I knew I had to gear up with something that would help me, get through that without any anxiety. So I began to look online and did some research, found some hypnobirthing meditations and breathing techniques, and we kind of put our own curriculum together. And I used my very best friend as my birth advocate. And she and I had this practice regimen that we would, do these scripts together and some stretches, very relaxed, relaxing music. And she helped me as long as, as well as my husband. They were a unit. We were all a unit in getting me to that birthing space. And my OB, Dr. Galdamez out of Little Rock, she was on board and she said, whatever makes you comfortable. She said, I don't care how you, get your baby here. I just, want you to not pass out. So, so that's what we did. And I had, I had a few requests going in to the birthing suite. I had said, please channel anything as far as information through my husband and my birthing advocate. I had, I didn't want any interruption. I wanted to be in my moment and in, the most relaxed space possible. So I used, hypnobirthing, and I had a grand positive experience. And I just thought, well, someone else needs to know about this. So that's why I'm here today as a certified hypnobirth teacher. I want to share this with you guys. So speaking of fear, as we know, fear enters the birthing suite or just the minds of us all the time. And we think about how our body feels when we have fear. There's a lot of tension. And we've heard previous speakers speak about tension, and a lot of the tension settles in our pelvic floor. And it's just a total shutdown. When we think about pain, tension, fear, they all really work together, but not in a good way. So oftentimes, if you see someone who is having a fearful moment in birth, they're experiencing the catecholamine. We're having like our systems of parasympathetic versus sympathetic kind of going against each other. And when that enemy enters that birth room via catecholamine, the body is not having it, not having anything, everything's shutting down. We find that we're in fight or flight, even freeze. If we think about the uterus in that moment, there's no oxygen getting to the uterus, so we may see failure to progress, which is, oddly enough, FTP, they're one and the same in that moment. So how do we get to, where do we find the endorphins, and how do we start bringing that positivity to the birth room? So next slide, please. So a way that we can do that is through the core techniques of hypnobirthing. So utilizing different breathing exercises. We have birth breath, we have surge breathing, calm breathing. So starting that rehearsal, if you will, or that practice in gearing up for birth it's vital to having that relaxed space and that positive mindset. We use guided imagery to get in that mindset. So visualizing the ideal birth, making it come to life in your head over and over and over again. And using, a birth partner in these practices when possible, because they play an integral part in that success story as well. And, giving them credit, giving them responsibility, and instead of just being an onlooker in the moment. So visualizing, the smooth, successful birth process also means getting rid of that fear that weighs us down and we call that in hypnobirthing, we call that like a fear release script. So we may talk through, anything that a patient or mother may be weighed down by. They're assigned, write this stuff down, write it down, write down your fears, rip them up and throw them away. And as an added piece to that, they visualize maybe even, throwing that into a fire and watching it burn, or envisioning raising the window and throwing out all the fear. So whatever gets that, gets them in the right set to then invite all of that ideal birth story, to bring in that birth plan and picture how they really want their mind and body to be ready. And every breath connects to that baby, and just becoming overall empowered. And another way we do that is through self-hypnosis. So we use hypnosis, but not in like the pendulum way that some people think. We're not, not hypnotists, but we bring on, different ways to sink into that deep hypnotic state. And if you've ever been driving and thought, man, I don't know how I got here, or been lost in a book, like when you're in that lost space, that's a hypnotic state. Or even when we're watching a movie, we are noticing, sorry, something just popped up. We're noticing that we're not tracking any time. We're in a deep, relaxed, our body's relaxed. We're feeling all of our muscles just loose and floppy. So an added piece of that, when all of the breathing exercises and visualizations and self-hypnosis are working all together and you are practicing all of this, you are gearing up for a positive birth experience. Okay, next slide. So a few benefits that you may see or may hear of from hypnobirthing mothers is they experience reduced pain. So less pain through these relaxation techniques and utilizing their hypnosis scripts, as well as under 8 hours of labor, less than 8 hours, they're noticing less intervention. And if we can get past that fear, tension, pain space and not open that gate to those interventions, we can, channel those endorphins, because endorphins are 200 times more powerful than morphine. So that's a really neat piece to hear, is that, just using these basic concepts that may have just been lost over time, they just need an opportunity to resurface, because these concepts are not, it's not new by any means, but we just may forget to just breathe sometimes. And you often hear positive birth experience. Just 85% of hypnobirthings reported positive, empowering, feeling more in control, and being given that control, knowing you have a choice in your birth, instead of surrendering yourself, at the hospital and being without opinion or without a voice. So yeah, we've got some great things to be proud of. Okay, next slide, please. Thank you. So in the training and coursework, there are 5 units, and it's a 12.5-hour course. So it's about 2.5 hours once a week that mothers would participate in. And there's an educational component. There's, like I said, there's visualizations, there's pre-birth parenting and preparing mind and body, deepening scripts to help them, tap in and out of those hypnotic states, being able to channel those as needed. And they also will experience there's even a fourth trimester piece that we go into as well to prepare them for after their birth. And here you'll see another piece of data here. It recognizes the comparison of hypnobirthing mothers and listening to mothers survey versus the US vital stats. So in looking at this, you guys know more about this kind of table, but it's showing a 50% difference here. So the cesarean rates are definitely lower in looking at that hypnobirthing piece. Okay, so how can you guys implement this into your practice or bring it into your hospital or clinic? And possibly educating staff, bringing in comprehensive training, or even going into a free info session about hypnobirthing. And then also considering the environment of which you have births. So thinking of maybe dimming lights or, facilitating more of a birthday vibe versus a medical vibe when possible. This is all assuming there's no underlying issues or, special circumstances. Another way is to, talk with expectant mothers about incorporating hypnobirthing techniques into their birth plan, and then working with your local birth workers, and as well as gathering feedback along the way. And noticing the language. Another huge piece to remedy the fear surrounding birth is trying a little bit of code switching and just noticing that the language we use harbors a lot of fear, just the typical traditional language. I mean, I know personally, I was very triggered when I would hear, certain words about what I may experience in birth, and contraction had a harsh tone. So in hypnobirthing, we talk about using surge or wave, because that's almost something you can envision a wave. And if you think about your body, being so relaxed and kind of floating, I mean, it's just it's a reframe, if you will, an easy, simple reframe that we can introduce and to facilitate that, relaxed mindset, as well as effacing and dilation. We may use thinning or opening, or maybe trying, instead of saying bloody show, saying birth show. So these are just a few words that we can change up. Okay. So now I invite you to participate, if you're willing, in a short self-hypnosis. And the way that we can do that is, first off, just taking a full breath in and out, taking a couple of breaths, and find yourself comfortably seated. I assume we're all comfortably seated, but maybe do a little wiggle to get yourself settled in and embrace the power of your mind. And what I'd like you to do is just think in your mind's eye that what I'm describing is actually happening. Pardon me for a second while I grab my script that I don't have memorized. Okay, so slowly inhale one more time. And maybe close your eyes. Continue to take a few beautiful breaths. Taking some breaths at your own pace and letting your breath just flow all the way down through your body. And as your shoulders begin to swoop and droop into the frame of your body, allow your breath to just drift down through your chest and into your stomach and down through your body. It flows all the way down into your toes, releasing and relaxing. Feeling your shoulders, your chest, and your elbows becoming limp and relaxed. And now, in your mind's eye and your imagination, take yourself to the kitchen. And this is a kitchen that you're very fond of, maybe from your distant past, a place that holds good feelings for you. Maybe it's a grandmother's kitchen, your mother's kitchen, a trusted friend, or maybe just your ideal kitchen. One that you would like to go back to at any time. And your subconscious can work quickly, so choose your kitchen now. Look around you. See all the familiar things in this kitchen. Feel the warmth of the room and breathe in the aroma of your favorite food as it cooks. See the steam, the condensation forming on the windows. And now imagine yourself standing at the counter in this wonderful kitchen. And in front of you is a cutting board. And on the cutting board is a bright yellow, round, plump lemon. You can feel and see every one of the pores of this lemon. Run your fingers over the lemon. It's almost wax-like. Study all the features of the lemon. And beside the board is a large cutting knife. Give yourself permission to pick up the knife. And now in your mind's eye, see yourself cutting the lemon in half. And watch as the juice runs down and makes a small puddle on the board. Now take a piece of the lemon and bring it to your nose. Smell the lemon. Take the lemon and sink your teeth into it. And be aware of the juices that may flow. Feel what is happening in your mouth. And be aware of the changes taking place. Now, when you're ready, open your eyes. that, those of you that participated, I hope you got a little relaxation out of that. That's just one of the examples that we use when, guiding childbirth participants in self-hypnosis. A few challenges and considerations around hypnobirthing should be mentioned. Often you hear skepticism just based on the fact that there's hypno in the word, but we're not doing, hypnosis or hypnotic, like I'm not a hypnotist, so I'm only practicing basic self-hypnosis with patients. But there's an unfamiliarity there. And maybe resource limitations. So there may not be, trained practitioners around where you are, and it may not be as available. And as well as, healthcare providers. As healthcare providers, you're faced with many, many time constraints. So that may challenge the comprehensive education and support, as well as cultural factors, beliefs around hypnobirthing, and they may not align culturally. And then there's always, room for the subjective data, but long-term studies are, always surfacing. And hypnobirthing is an international institute, so birthing around the world. The participants get to see birth videos in class, and in comparison to different countries, and that's just a really neat aspect. Okay, next slide. And in conclusion, hypnobirthing offers a range of benefits for both mothers and babies, including reduced pain, shorter labor, and fewer interventions. Evidence-based studies support its effectiveness, making it a credible option for childbirth. And by integrating hypnobirthing into your practice, you can provide a more holistic and empowering birthing experience for your patients. And if we, help release the fear and replace the fear with confidence around birth, it can have an everlasting effect on, on them as far as birth, but beyond birth. So let's keep that in mind and empower. Thank you all.
Thanks, Taylor. That
Thank you.
was great. And I know even as, when I think about myself during my years as a labor nurse, I mean, we kind of utilize some of those principles where we have the mom, like, you want to like focus on me, let's breathe together. And we all know that sometimes, that helps our mom kind of, rise in that situation of maybe a strong contraction while we're waiting for our epidural, helping them calm down. And so things like hypnobirthing and Lamaze and different techniques, birthing practices do help our moms kind of prepare and be ready for birth.